I was 14 when I was diagnosed with lupus and several other chronic autoimmune conditions since then. I got a couple of letters from the insurer saying that they were not going to pay for that service. We were looking at about a year's salary worth of medical bills if we didn't figure out a way to get the insurance to pay for it. Health Access Innovation is an organization that helps people respond to wrongful denials by their insurance. When I was able to get access to this support, I suddenly had somewhere to channel my energy. And that fight was way harder than I could have anticipated, but at least I was given the tools to do something about it. I was amazed that there were people willing to do that for me for free.
I'm Mike. I'm the founder of Health Access Innovation. We're a nonprofit that helps people in America access healthcare by helping them appeal health insurance denials. I became an expert on appeals by necessity. I have Crohn's disease, and accessing the medication I need can be a full-time job. My most recent denial took over 30 hours to resolve. I had to prove that my insurer had violated state law to regulators who didn't know the law existed. My experience isn't unique. There are over 20 million wrongful denials each year. They lead to debt, prevent access to care, and worsen health outcomes. Appeals work, but most people never file one. They're busy caring for a family member, working an unforgiving job, or in the hospital just trying to get well. No one should have to navigate wrongful denials alone. So we support patients in filing appeals. People submit requests for help, and we do the heavy lifting. Caseworkers use our machine learning systems to build a patient's appeal. Our technology streamlines research by surfacing evidence from coverage rules, medical literature, and medical records. We deliver the appeal and guide people through multi-stage submissions. Technology makes our human-centered work scalable without sacrificing quality. And it helps us track evidence of wrongdoing, which we bring to regulators. For-profit companies using AI for appeals prioritize speed over quality. But patients don't get unlimited chances. A low-quality appeal can fail, and failure can have devastating consequences. We're a nonprofit because we're accountable to patients and prioritize equity and access. We're funded by grants and donations so that income is never a barrier to filing an appeal. We aim to partner with community organizations, physicians, and worker groups to reach communities in need where they are. Our focus is urgent, underserved medical contexts, including cancer, mental health care, and asthma. To date, we've achieved a 95% appeal success rate. And recovered $850,000 with almost no funding. Most importantly, we've helped many people access care they wouldn't have otherwise. Our team has worked on all sides of the system. I previously built AI initiatives at the Allen Institute for AI. Our founding team includes an ER physician who led quality improvement at the New York State Department of Health, and a director who leads operations at a federally qualified health center. We fought these battles both personally and professionally. We're raising $500,000 to recover $5 million annually. Along the way, we'll generate the data policymakers need to drive reform. Our work isn't just about denials and appeals. It's about access to healthcare when people are at their most vulnerable. Join us in pursuing a more just system. Thank you.